tunataka pesa. Basi julikane sisi hatujaoga leo.
Where should the money be? Why are they getting the money to fly out for benchmarking in India, Denmark and other countries, yet they doesn't have the money to pay the workers? We say we are very much willing to work, but we are very much disgruntled. Actually, as you have heard the views of some of the workers, some have not been able even to bathe this morning because they can't afford to buy a soap.
Yes.
There are some who never even came to job today because they doesn't have the fare to pay to come to work.
True.
And we have said, enough is enough. For us, we use our brains. We don't use our energies. And if an healthy worker is not happy in his mind, then it means he can't give the best output. So I want even to tell our public members that they are risking their lives coming even to see us to attend to them when you are very much disgruntled. And today we have decided as all the health workers and all unions that as from today, by 12 the money will not have been paid. We are starting the sit-ins, which is a constitutional right, and it doesn't have to give a notice to start a sit-in.
We wanted to put a very clear demonstration in our county government and put this question forward. If Kakamega County, if Nairobi County, if Kiambu County, if Nyeri County, if Mandera, if Turukana, if the Rakanidi are paid their workers, what is so big that the county government of Meru cannot pay workers? So you are saying enough is enough. We are saying unless quick measures are done upon a number of hours that are remaining, we are saying from tomorrow you are going to start the salary parade to the county headquarters with an aim of compelling our county to give us news. It doesn't make, we are not concerned. We are going to get our news from whether the money is going to come from Dubai. We don't care where the money is going to come from. We don't want to care whether the money is going to come from Israel. Whatever our workers are interested is getting their news in good time. We're also saying that the battles which is there between the county government and the national government, it is none of our business. Whatever is our concern is to get our news upon the completion of the month. Right now, we are way past the 10th, and I remember that our very first promise was that upon the 28th of every month, we shall get our news. Right now, we have gotten all forms of harassment from our landlords. We have gotten all forms of harassment from our schools. We have gotten all forms have been reduced to beggars. We are saying that health workers are not beggars. Are we beggars?
No. And it's an unfortunate moment for us just to be fighting of salaries. We are very few healthcare workers in the county. They are not enough. Now you are even overworking the few you have. On top of that, you are not paying them anything. It is pathetic. A situation that we know, we are aware. The county government have money for the current expenditure. They were given money. They have money. But they want to use healthcare workers. I don't know why healthcare workers to fight their supremacy battles with the parliament, the national government and the counties. It's unfortunate. What we are saying is we cannot have healthcare workers who are not even bathed, who have no traveling. I mean, they have nothing to support them to come to work. How do you expect them to come to work? How do you expect them to explain to the landlord on date 15 that they are not paid the rent? And this landlord know you are employed by the government. In the 21st century, we are talking about healthcare workers going to work hungry. Which services are they expecting us to provide to the patient?
Madaktari na pia ambao wanahusika waweze kuelewana kama ni haki yao wapate, ili waendelee kuhudumia Wakenya, kwa sababu Wakenya wanalipa kodi na wanaumia, na sio kama ni vizuri, kwa sababu watu wengi hapa wanategemea hii hospitali ya level 5, hawezi enda kutibiwa pale pengine. Hizi private hospitals ni very expensive, kwa hivyo hapa hivi ndio wanaweza faidikia na hakuna msaada wowote. Kwa hivyo mimi naona wasikizane, pande zote ambazo zinahusika wakubaliane, ili madaktari waweze kurudi kazi, wananchi waweze kuhudumiwa. Asante.
Sasa sisi tunauliza kwa hii serikali yetu ya kaunti haiwezi lipa misara bila kupea wananchi sinda. Sasa tuko na wagonjwa, ndio huyu alikuwa anataka kutibiwa lakini hakuna daktari, wote wamegoma. Tunauliza tutakaa hivyo, wanataka tukupe ama wakikaa kwa mbunge wanajiwekelea msara, lakini hawataki kujua wengine vyenye wako. Ndio tunauliza hivyo hiyo serikali yetu.
Sasa wewe mgonjwa unampeleka wapi?
Sasa mgonjwa sasa nataka kumpeleka huko nyumbani, ndio huyu. Na ni nyumbani nampeleka kwa maana serikali, kwa maana hospitali wako na mgomo.